It is no longer news that Nigeria is facing a significant shortage of medical doctors, which is undoubtedly affecting the overall quality of its healthcare service delivery. According to the Nigerian Medical Association (NMA), of the 75,000 Nigerian doctors registered with the association, more than 33,000 have left the country, leaving behind 42,000 to take care of more than 200 million people. And the tide doesn't seem to end soon as doctors continue to leave the country in droves for greener pastures. Galaxy News correspondent Lebby Joseph filed in this report.
Drain in Nigeria could be attributed to the failure of health system leadership in the country that stems from poor insight and neglect of the problem. Nigeria's healthcare professionals have been migrating in drones to the United Kingdom, United States, Canada, Australia and other developed nations.
There are a lot of factors that are making people to either leave the country, which includes remuneration, security, enabling environment, and ability to even exercise your dexterity to the fullest. And of course, the research are there and some other things. Right.
The factors responsible for people, doctors living for other climes are push and pull factors. The push factors are those hostile factors that make people want to go away from a particular place. Hostile environment, unpalatable, issues coming up and down, hardship, economic, social. And these are things, security issues, these are things that are pushing people and affect everybody alike, including doctors.
The country healthcare industry is facing challenges associated with outbound medical tourism, deteriorated medical infrastructure, low government budget allocation, and poor compensation and subsequent immigration of skilled healthcare workers. The federal government allocated a paltry 4% of its 2024 budget to health.
The implication is that people die. It's that simple. I'm sorry if the language is harsh, but that is the truth. And until we begin to see the reality of situation, it doesn't look like we have hit it yet. When you take care of one doctor, what it means is that you have taken care of all the patients that this one doctor is going to take care of. If you keep your driver hungry or angry, and you have an expensive car of 100 million, it is the same hungry driver. You want him to drive you and not run into pothole and crash it and tell you, sorry, sir.
We have the problem of infrastructure. We have the problem of manpower. And of course, the knowledge base is also part of the problems. So, infrastructure, yes. Manpower, yes. All right. And what to use is also part of it. All these are what we have together, and that is the problem in the health sector.
It is pertinent for government at all levels to prioritize health, invest more in the health sector, and improve on welfare of health workers, especially doctors, as incentive to attract more personnel into the sector.
I expected government to put more votes into the budget that is going to health. However, what we saw is just 4.9% of the total budget, which is not in tandem with Abuja Declaration 2001 that AU country came together and they decided that for any state or any country to have a meaningful health, you must at least appropriate 15% of the gross budget.
And the doctor has not asked that you empty the treasury for them. The doctor has not asked for you to buy him a Rolls Royce. The doctor said, give me somewhere to lay my cheeks in terms of accommodation. The doctor said, give me a mobility from where I live in Ajangbadi to go to Ikorodu General Hospital to go and work. The doctor said, look, I pay tax like everybody else. I don't get anything extra. Give me some rebate. The doctor said, I am sick. I work in the hospital. I don't have to pay in the hospital where I work when I fall sick. It doesn't make sense.